Hello and welcome to Telehealth in Practice. This is the first in our on-demand videos that is part of a 16 presentation series. I'm Dr. Ted Hudspeth and I'm a family practitioner. This on-demand Telehealth in Practice webinar is about best practices and caring communication in telemedicine. If you haven't been able to join us for the previous sessions, these recordings are all available on our website for you to view at your convenience. All of the sessions in this webinar series listed here will be recorded and are available on our website at walpen.org/telehealth. We will also have some on-demand sessions posted on the website within the next few months, so stay tuned for these. And actually, this is the first one that we will be doing. As a reminder, this webinar series is funded in part by the TexLa Telehealth Resource Center. TexLa is a HRSA-funded program at Texas Tech University and is designed to provide technical assistance and resources to new and existing telehealth programs in Louisiana and Texas. TexLa is partnered with Well Ahead Louisiana to serve as the support representative for Louisiana providers. TexLa is also part of the National Consortium of Telehealth Resource Centers. You can access the website and resources from all of the TRCs across the country through the consortium website, telehealthresourcecenters.org. And with that, I'll introduce myself a little more. I'm Dr. Ted Hudspeth. I'm a family practitioner, been in practice for 27 years. And several years ago, I started performing telemedicine through my own clinic. I also work not only in Hammond, Louisiana, but also in Baton Rouge, where I perform endoscopy at Ochsner Medical Center of Baton Rouge. I actually currently serve as the Medical Director of Informatics for the Baton Rouge region. And I am proud to be here and talk with you at this time about a topic that's really near and dear to my heart. And that is working with patients and how do you provide value to them? And that's really what we're going to talk about. So to start off, I'll start with a quote. A caring heart that listens is often more valued than an intelligent mind that talks. You know, my mom always used to tell me that you have one mouth and two ears, so you should listen twice as long as you speak. And that holds true today, especially in my practice. So we'll go through a little overview here, things that we will be going through in this session. We will talk about drivers of care, and that's drivers of how patients are cared for and really their outcomes. And we'll talk about caring communication as part of that. And in that caring communication, we learn to establish trust through three different things. That's an empathic connection, an authenticity, and a logic or understanding that we're able to convey to our patients. And all of that drives outcomes. And I'll show you some statistics on that. I'll also show you some of the best practices that you can use in your telemedicine practice to be able to establish all of these. And at the end, I'll show you a really nice little short cartoon video that says a whole lot in 2 minutes. So let's get started. First, we'll talk about the drivers of care. I want you to follow this as a circle right now. Think about this circle, one thing leading to another, because to start off with, patients have choices and seek value. You do the same thing when you're seeking out any type of business or service yourself. And specifically with patients, choices are driven by the experiences that they've had. If they've had a good experience, well, they're going to probably come back to you. But more importantly is that experiences are driven by connection. It's connection with the provider. And that connection is driven by the provider using caring communication. when you use caring communication, it really boils down to two things. Patients want to feel like you know who they are, and they want to feel like you care. And that's what we all want just as humans from one another. So this is kind of like going back to kindergarten. Everything you ever needed to know, you learned in kindergarten, and you can apply it in your practice, okay? But in all seriousness, though, people know that you care and they are more engaged when you use emotional intelligence and a high amount of empathy. So emotional intelligence is where you understand their feelings and where they're coming from. So the next part of that is that engagement drives patient activation and compliance. Activation is when a patient is activated to do the things that you said are recommended, and they're compliant with that over time. And this compliance then drives better outcomes and therefore your value. It all comes down to that. This lecture, actually, we had a sister lecture. It's number 8 in our series, if you go back and look at it. And it's about value metrics in telemedicine. So in that lecture, I basically went through all of the reasons why you need to provide value. This presentation is going to teach you how to do it, okay? So all of that flow that I just talked about is basically how patients derive value from how you practice. But there are steps beyond that. And it's what do you gain out of that? I truly feel that when you employ these techniques, that this drives your own purpose. It drives you as a provider to feel like you have basically earned your purpose that you've always been striving to do in your practice. And purpose drives resilience, and resilience drives out burnout, okay? So think about all of this as a circle, and it all starts with patients meeting you and being engaged with you through caring communication. So let's talk about that caring communication a little bit. When you use these techniques, it starts driving out anxieties that patients have. You know, they're coming to you with problems and they're very anxious about that. And when you drive the anxiety away, it basically helps them feel more comfortable where they can share. And it also makes a connection. When you can make that connection with someone, then they become more engaged with you. So with decreased anxiety and increased adherence, you drive that outcome and you drive the physician engagement with the patient. Now, everybody has wants and needs, and I feel like in a visit, when you walk in, there are certain wants and needs that they have. And the first is they have a need to feel acknowledged. I mean, that's just a basic human right. And so acknowledging who they are and respecting who they are is important. And also think about the other people in the room. When someone comes with a patient, they're there to help them. And make sure you introduce yourself to them and know who they are. And then when you also introduce some of the folks on your team, ask if they've met so and so, you know, in your clinic, and manage them up. When you manage them up, you actually show that you are part of a greater team that communicates. And that is very important to feel like the team is communicating about their care. The duration that you spend with the patient, the duration of time, you know, you're respecting their time. And then towards the end, explaining everything to them basically allows them to feel safe and comfortable with all of your recommendations. And at the end of that visit, thank them. Thank them for coming to you and let them know that you appreciate and want to assist them. So I think about the encounter as 3 different phases, you know, beginning, middle, and end. And to go through it, you know, when you first walk in, that first part, you're making first impressions. And you always try to lead off with a non-clinical type, you know, discussion. Uh, what have you been doing for fun lately? Things like that. When you lead with that, it really lets them know that you're comfortable with them, you are interested in who they are and what they're doing, etc. And it also kind of sets the tone and the demeanor of the entire visit. When you move past that and go to your next specific item, you're asking them, why are they there? That kind of establishes, the individuality of the patient and what they feel is the most important thing for them to gain from their time with you. So then as you move into the middle portion of the visit, listen to their whole story. The average patient is interrupted in the first 18 seconds of their visit, and that to me is just a crime. My experience is that people will basically say their piece and tell you all the bits and pieces of what their problem is. You can fill in a few gaps later, but let them say their piece. And after that, they will feel like they've been heard. When you do your physical exam, try to share those exam findings with them as you're moving through. And they will actually probably have less questions about things because they feel like they know what you've done and they know what the findings are as you do them. Afterwards, informing them of any test results and go through a working diagnosis. Try to even include some of the things that you considered but don't feel is present, because many times they've already Googled everything and have a fear that maybe they have some really serious thing, and you're comforting them by explaining to them that you considered thoughts in their minds would make them feel better. Explaining their meds to them and making a shared plan is very important, because they might not be able to afford the medicine that you plan for them, or do not have time to do some of the things that you're needing them to do or wanting them to do. So coming up with a shared plan on that is very helpful. And then closing the loop at the end, closing out with making sure that they understand everything that you told them and answer any questions. Excuse me. Teaching back is a technique where you can actually ask them, what did I say? Ask them to explain to you what you've told them, and that will help you know that they understand the plan. And then at the end, show some appreciation and admiration for them. In doing that, you again show respect and you leave a lasting impression. People often remember the way that you made them feel. And that's a very important thing to do in a visit, especially if you're trying to make a connection. So in trust, or in developing trust, there are different parts of that that I think are key and very helpful if you think about it like this. First of all, if you establish an authenticity with someone, that's your first thing that you need to do to establish trust. And in that, you're just letting someone experience the real you, in all honesty. The next part is trying to have some logic. If you can explain to someone at their level about what's going on with them, then they really know that you cared about them, was very interested in them knowing what they need to do to move forward and to get healthy again. And then the third piece is the empathy piece. This is where you're actually showing that you care about the patient and their success in getting better. So if you can generate all three of those parts, you will establish trust with someone. The evidence shows that patient trust is very important for higher patient satisfaction scores. They perceive that their care is better whenever you do this, and it generates a feeling that they're going to come back to you and do the things that you need for them to do, especially when you have that high patient satisfaction score. Now, doing this is not always easy because our appointment times are short and many patients only come 1 or 2 times a year. And then there may be some educational barriers or social barriers that also make it harder for you to establish that rapport. And sometimes there are language barriers that do the same thing. So it can be difficult at times. So strong communication skills are very important in being able to do this with a varied population. And again, there's three things. It comes down to the logic and the empathic connection and the authenticity that you are trying to express to be able to earn trust. So visually, in employing some of the empathic cues that I'll teach you later, that's where you make your connection. And combine that with your logic and your authenticity is where you establish that trust. And from the trust, you gain acceptance and compliance and adherence and honesty when you have decreased their anxiety. And all of that drives an ultimate outcome of trying to make them better. And so that's kind of the flow of what I see as a very good method to be able to establish or convey the way that you are feeling to patients. So let's talk about the empathy piece of gaining trust. Unlike sympathy, which is defined as feeling sorry for another person, empathy is the ability to stand in someone's shoes, convey an understanding of their situation, and being ready to help. Showing that desire that you want to help them. Right now, about 70% of hospitals are actually employing patient satisfaction scores in their compensation to physicians. And the good thing about this is that empathy can be learned. So people are being sent to empathetics classes now to be able to learn this. And it's more, besides outcomes, it's really the demographics and the business is driving this. People want this in their providers. And as we move more towards a consumerism market in medicine, this is going to become ever more important. Many people who do not have, or many providers who do not have good empathy actually get sued more. That's been shown in many studies. So that's another reason to try to learn and employ empathic cues with patients. Empathy training has also been shown to reduce burnout in providers. And as I said, it drives outcomes. And one of the pearls that I will give you here is that if someone is expressing something that desires or would be great to have an empathic statement with, you never answer a feeling with a fact. Always remember that. Never answer a feeling with a fact. That's just, it just comes across kind of cold, okay? So some of the ways that you do this is actually your phrasing. Two great phrases are must be and sounds like. If you remember those two, that's a great start. Because when someone says something, you could say it must be very difficult for you, or it sounds like you're having a hard time with that. There you're not stating some kind of a hard, cold fact. You are expressing your understanding of how they are feeling. Making eye contact is one of the most important things you can do, especially in a telemedicine visit. You don't have the ability to use touch, etc., in a telemedicine visit, and the eye contact becomes ever more important. And we'll talk about that in detail later. Using a warm tone with people, leaning in and having a proximity, even though it's through telemedicine, that's helpful. Showing admiration, which you can do either in person or on a telemedicine visit, and acknowledging people. That, again, can be done in a telemedicine visit. So going through some of these phrases, must be and sounds like is top of the list, but saying other things like that must be difficult, or that must be very frustrating for you. Sounds like you're going through a lot right now. That must be miserable. I can't imagine what you must be going through right now. And that must have been awful for you. Those are all statements that you can use to make people feel, more like it's something you really care about them. And that's really what you're trying to do there. Now, empathic phrases don't always need to be about negative things. They truly need to be about exciting things and happy things. So saying, I'm so glad you're feeling better, or you're completely healed. This makes my day. Your cancer is shrinking. I'm thrilled. We've gone through a lot together, and I'm so glad you're better. It has been a long road for you. Go reward yourself. You've been injured in the war. Thank you for your service. So all of these are good statements, that you can say to people to make them feel better too. So the last piece of that trio was logic. When you explain reasons behind the plans and the way that you want to do things, when that aligns with someone's intellect and educational level, you have really done a big job, okay? So being able to explain something to someone so that they can understand what they need to do and why they need to do it is just good common sense. I do use the teach back method that I talked about earlier. Um, it's great. I'm going to say this one and quote it. I know that there's a chance that your son is going to ask you about your visit after you return home. Would you mind telling me what you will tell him regarding your health condition and our treatment plan? So that's a great statement there, that you could have someone teach back what you've already taught them so that you can gain a better understanding of what they truly understand, okay? And there are some other keywords that are good. One is, I want to make sure that I spend enough time discussing blah, blah, blah. When you go through that, you are expressing to them that you're spending time. You said it. You said you were going to spend more time. If you say, let me explain this more clearly, it shows that you're taking the time to be able to explain something to someone. And now it's my turn to listen. So when you actually say that, and later they will remember that you took time to listen, you even said it. So those are some nice keywords that you can use to have folks feel like you're taking the time with them. And then narrating the care. People come in with a certain set of understandings or thoughts about what they have, and by you actually teaching back, your heart and lungs sound great to me today, etc. When you narrate that care to them, it really gives them a better understanding of what they've had done. And then authenticity. Authenticity it's really a set of characteristics that people have that let others know who they are, the real them. They generally have realistic perceptions of reality. They're not very grandiose. They are accepting of themselves and other people. They're thoughtful and have a non-hostile sense of humor. They express their emotions freely and clearly. And most importantly of everything here, in my opinion, is they show vulnerability. Showing vulnerability is a key to all of this process. And that's a big important part of, like, showing that you can make a mistake. If you make a mistake and show that you're vulnerable and you own up to that, that's a very big thing for people to let them know you're human. And that shows you as an authentic person, because we all have or make mistakes and have errors, and owning up to that is very important. It also shows your true self to others, and it puts people in a position to not be defensive about their time with you, and about things that they may be doing that may be very important for you to know when you're establishing a treatment plan for them. Now, people who are authentic often use motivational interviewing in their skill set to be able to kind of change the conversation around to where the patient actually has their own ideas about how to get themselves well. And this is often used in folks who you might want to have them stop smoking or drinking, or work on their diet and lose some weight. A lot of times, if you just talk around the subject, then they actually come to the solution. And at the end of that, you make that a shared decision and then you support that. And when you do all of that as a clinician, you've really done your job with this motivational interviewing. And remember, the success of this really hinges on your connection with someone when you've been authentic and been empathic and have logically explained why you need to do something. So in speaking about all of this, it does come down to outcomes, because your outcomes is how you truly, at the end of the day, prove your value to others. And, today we're not just proving value to patients, we're also proving value to insurers and the government and just about everybody in the world, right? And your value comes down to some of these core issues that we're talking about here. And when you look at it, there are many studies showing about how all of these parts I've told you drive outcomes. But there was a very good one in concerning diabetes and lipid management. They showed that providers who gave higher empathy or had higher empathy scores from patients also correlated with lower A1Cs and lower LDLs. So it basically proved that those people who had a high emotional intelligence and drove that through these methods actually had better patient outcomes. So that is why when a leader wants to talk to you about your patient satisfaction scores, it's really not a bunch of bull. I mean, it's not just a way to get at you. It is truly showing what you are doing with patients and driving their outcomes. So I would recommend trying to learn some of these and employing them in your daily practice. So talk about practices. Let's talk about some of the best practices in telemedicine, because there are some things that you can do to basically prepare for your visits and then engage in your visits in ways that makes patients feel more comfortable with the experience that they had in their telemedicine visit with you. First of all, you dress professionally and wear your badge if you are at an institution where you have one. It shows your professionalism. You want to mute your pager and phone so that you're not interrupted during your visit. You want it to be about them and their time. And you want to ensure that not only you are in a private space, but also the patient. I always try to ask, are you in an area where we can talk about things, where you're out of earshot from anyone else? Because you don't want to be in the middle of a story and then realize that someone else is listening in. You also want to make sure that your internet connection is working good and doing well with that. So the next thing is setting up your workspace, making sure that you are lit from the front and not from the back so that you don't have shadows all over your face. That's important. And you want to try and keep, the upper portion of your body in the screen and certainly centered in the screen so that they can see you. And you want to try to make the background behind you uncluttered. Uh, make sure that Try to make sure that you actually don't have a door in your background. Um, Providers who had a door in their background scored poorer on patient satisfaction scores. I don't know if it's that it conveyed the thought of you're about to leave the room or something. I don't know, but it has been shown. And try to review all the patient, not only complaints, but some of the history before you go in. Again, we started this off that patients want to feel like you know who they are. Well, I don't have a photographic memory, so I always have to, refresh my memory before I just dive into a visit and logging on with patients. So that does take a moment to do. And then I try to frame the visit, with the beginning and the introductions. I actually say, I've reviewed your record and tell them what my understanding is, and then ask them to tell me more. So off the bat, I get them to feel like I know who they are, because I do. I have looked at their information and I know stuff about them, but I've said that to them. Again, I'm narrating to them what I've done. And then framing it in the back end, in a seated position, I sum up the visit and talk about how now it's my turn to listen. Again, I say that so that people later will say, yeah, he listened to me. He said he listened to me, and then I ask for final questions. I try to definitely use those empathic phrases if someone is having pain or suffering, because that's a real great way for you to be able to connect with people. And then I also deliberately show any feelings of joy if there's something to be joyous about. Again, I narrate the care. And, when you are in a telemedicine visit, you are actually employing their help a lot of times to be able to help you do the exam. If it's a range of motion of an extremity, you actually may show them how you do it, or tapping on the sinuses, or getting them to open their mouths and maybe hold down their tongue themselves, or position a light where you need it. All of those things have to be narrated, and you have the opportunity to be able to kind of tell them what you're doing and what you're looking for. Also, for later, it lets them understand what you'd be looking for should they worsen. So it's a great teaching moment. And then when I'm closing out, being able to manage up my team, I talk about how I'm going to send this to, one of my team members. I'll name them by name and say they will be connecting with you so that, you can get everything ordered or scheduled that we've planned for today. And I manage up about, how good they are and what they do for me and our team and our communication skills and things like that. And that really helps out. And there's a concept called triangulating with the EMR. In a face-to-face visit, you triangulate with the computer by actually turning your screen to the patient and showing them what you wanted to show them or elucidate. And that makes them feel like they're understanding what's in that big box, that screen. But in a telemedicine visit, some platforms actually do allow you to share your screen with the patient. So you can show them and bring up things that you want to explain to them with graphics and things like that. So I love the triangulation piece. And then really waiting for the end of a sentence, waiting for that period, letting them finish their statement. We ought to do that no matter what type of visit we're in. I mean, it's just rude to interrupt. And they say that on average, the patient's interrupted in the first 18 seconds of the visit. So we need to do better with that. And that makes patients feel like they've been heard and that it was important. You also want to be able to communicate your instructions on what to do. And this is where you can also use that teach back model. And you can demonstrate, you should be able to demonstrate comfort and confidence with the telemedicine platform itself. The visit ought to be about the patient, not how to figure out the technology that you're working with, okay? So although you might have the jitters when you first start doing it, you've got to be cool as a cucumber. So practice with it. Remember that the patient cannot see what you're doing off the screen also. So for instance, if we're discussing something and I'm looking all around, actually I'm looking at my screen, the patient's just seeing me all looking around, so that could be a little disconcerting. Think about what they're seeing on their end. So, in my workstation arrangement, I have an iPad that's kind of down, at one level, and then I have the EMR on a different screen, and I'm looking in a different area at that. So before I take my eye off of the camera, I actually tell them, I'm going to look at your medicine list now, or I'm going to look at your history on that. Give me a moment. And, then I can turn and they actively know what I'm doing. And in the middle of changing screens between maybe looking at their meds or their history, et cetera, I'm telling them, oh, I'm looking at your history now. I see that you have, thus, such, and other. And I basically narrate what I'm doing in that telemedicine space. I also try, as I told you, to get them to demonstrate various things with the exam. So I may have to actually show them how I need them to bend their arm or their hand or some kind of an extremity if I'm doing an extremity exam, et cetera. And by the way, we do have one complete lecture on doing physicals and doing exams in the telemedicine space. So be sure to look at some of our other videos that we have posted. You should speak clearly and deliberately and pause to allow for any transmission delays. Sometimes there is a little bit of a pause and you need to make sure that you're not overlapping some of the things that you said. And sometimes that interplay between when you stop talking and when a person wants to start talking, that can be a little bit awkward. So sometimes giving a visual cue at the end of your statement, like, what do you think about that? Things like that to let them know, yeah, now it's your turn to speak. So those are some little cues that can help you make it a more comfortable transition, especially if your bandwidth is a little bit choppy there sometimes. And there's a mnemonic called SAVE that is actually helpful to remember ways to show empathy. And that is, you show support or partnership with this with partnership statements, and those are some of the statements we've been through. You acknowledge their situation. You validate their feelings. You can even say, I understand you're sad, or things like that. And then you name their emotion. So E, that's the SAVE, that you name that emotion. And that's a very powerful thing to let them know that you understand how they feel. Verbalizing those collaborative steps next is very important, because there you can basically both decide on how you're going to make a care plan and how you're going to carry that out. And that if that's done together, they're more likely to follow it, and therefore you have provided value when they do that. And at the end, expressing that gratitude to them that they trusted you enough to come and let you be a part of their care to help them feel better. And expressing to them that you're looking forward to making them feel better. That's another really nice thing that makes people feel very good about their time with you. So in the telemedicine world, asking them those final questions and inviting them, if they feel like they've done everything we need to do, they can press on the button and end the visit. And I try to let them do that first. So I'm not clicking out of that and seeming anxious to get out of the visit. So I think that's a good thing to do too. So your website manners basically can be really difficult if it's an audio only visit, because there you're just coming down to a voice. You have no visual cues or anything else that you can use your body language to help express your feelings towards others. But remember, people can hear through your smile. Your smile changes how you speak. So try to make sure that you subconsciously smile as much as you can when you're talking with people on the phone. And you can always reflect on what you admire about them and express your feelings in words. I also try to elicit specific reactions about, what do they think about that? How do you feel about that? Just to make sure that I can gauge, especially when I'm recommending we do certain things, I ask them their feelings about that and try to say that to me. And again, we talked about all these empathic cues, especially in the telemedicine space, that are infinitely very important, because you don't have touch as something that you can do in a visit. And also, it's very difficult if a patient's language is not English. So you must be able to employ the use of an interpreter to even be able to move down, these steps. This is just a visual for you to get a little more in depth in the SAVE mnemonic if you want to reference back to that later. So after the visit, I share my after visit summary with the patient so that they now have a visual of everything that we did, and they have a plan that they can go by. And I then send everything to my nurses to be able to assist the patient in being able to get things scheduled. And I verbalize to the patients that I'm going to hand this off to, one of my assistants, and that gives them an understanding of where do we go next. So I want to discuss in a typical visit, the concept of sitting versus standing. In the green, this is the actual time that someone was standing on the left versus sitting. And you can see those green bars are fairly equal to each other. But the patient's perception of time in both of those was very different. For the provider who stood, the perception of time was much less than for the provider who sat in the visit. The reason I'm bringing this up is because I feel like the equivalent of this in the telemedicine space is really your eye contact. And so eye contact is, to me, one of the most important aspects of that whole interaction, as far as the nonverbal cues that you can use to be able to have people feel more comfortable with you. It really impacts a sense of dignity to the patient, and it helps establish a rapport and part of your trust. So I feel like this is very important, and why it's something for us to talk about is because when you look at the patient directly in the face on the screen, you're not looking at the camera, okay? So you're no longer looking eye to eye, so to speak. So this takes some practice to be able to get used to it, okay? And once you figure all of that out, then you have to really start thinking about specifics in certain people of certain cultural heritages. Studies have shown that Arabs, Latin Americans, and Southern Europeans make more eye contact during conversations than Asians and Northern Europeans. Japanese may consider eye contact rude. And so people are often taught to look at the Adam's apple in conversations. And so, and another thing is women generally hold better eye contact than men. There's also an age difference. You know, from 4 to 9, people start getting more and more eye contact. Between 10 and 12, that goes down. And then later on into adulthood, that starts ramping up again. And there are also certain mental health conditions where people do not hold eye contact. So what I'm asking in going through all of this is, again, you have to use your emotional intelligence and take cues from your patient and how are they, responding, etc. And then you should be respectful of them and, do a similar thing to make them feel more comfort in your presence. So in doing all of this, you actually have to look at how you're positioning your camera using about a 7-degree angle. That's not very much, but that is kind of the area that you would be normally if you were with someone. And so visually you can see this just a little bit above the midline. It establishes where your cone of gaze is positioned, okay? And you try to use higher resolution cameras, not only for them to be able to see you better, but if you're doing a lot of telemedicine visits through your day, it really helps with the eye strain. And something I really suggest you look into is getting a camera with a zoom. They are a little more expensive, but you don't want to be too close to the camera because then people may feel like you're invading their personal space, even in the telemedicine world, okay? But sometimes you need to be at a certain distance from your screen to be able to see it with clarity, okay? So being able to have that variable distance and zoom with the camera itself helps you to be able to get that sweet spot to be able to do both ends of the visuals on that. And so you should maintain your gaze, but you don't want to end up staring either. Okay, so you have to kind of think about that, think about what you're doing. And again, it takes a little practice getting used to, but the reason I'm bringing these up is because if you just think about it one time and start going through these paces, it will become second nature to you. And also try to keep yourself centered in the screen like I'm doing right now. I'm not going from one side to the other. Another thing to think about is your blinking. As you are speaking, you tend to blink faster. As you are listening, you tend to blink slower. So if you start blinking a lot while you're supposed to be listening, that's not very congruent in people's minds with you being patient or listening. It more looks like you're impatient. So think about how you're doing that too, because again, it is very important to how people perceive you and the time that they spent with you. So additional pointers are basically trying to understand these gaze indicators, and misunderstanding them may lead to improper or impersonal interactions, if you're doing it wrong. So again, I think taking cues from how the patient is interacting with you is just your key to success on that. And so the last part of this is, I told you I wanted to do a little, or show you a little video. This is a video by Brene Brown, which if you have not seen her, you should try to learn everything you can about her. She is phenomenal, has a, I think it's a Netflix special on that is very insightful. And she made this video about empathy. And I think it says in a couple of minutes everything that you need to know about being empathic. So I will get that started now for you.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you can climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
What makes something better is connection. And that's truly what we are trying to do here, is connect with people. Nobody cares how much you know until they know how much you care, by Theodore Roosevelt. And that pretty much sums up everything here. They want to know that you care, and they want to know that you know them. And I hope that these tips are helpful to you to be able to understand that not only does it drive value for the patients, but it drives value to you. When you do this, it actually allows you to be able to connect with your purpose. When you connect with your purpose, then that drives your resilience. And ultimately drives down your burnout risk. So there are many reasons to do it for value, not only for your patients, but for yourself. So thank you for joining me. Moving forward, we do have many resources as part of all of our PowerPoints that you can look through if you are establishing a telemedicine program, and use them, because there are some very good resources from lots of other folks who know a lot about telemedicine. And if you have some questions, please send those to wellahead@la.gov. And you can see all of our presentations and the PowerPoints at www.walpen.org/telehealth. I'm Dr. Ted Hudspeth, and I want to thank you for joining me, and I hope to see you on some of the other videos.